Intrauterine death, a fetal death occurring after the 20 weeks of a gestation and before delivery. Maternal causes like hypertensive disorders, preeclampsia and eclampsia, diabetes mellitus, infections like a torch infection, syphilis, chorioamnionitis, autoimmune disorders like antiphospholipid syndrome, SLE, thrombophlebitis, a factor V. Placental causes like the placental abruption, placenta previa, cord accidents, true knots, cord prolapse, and the cord thrombosis, uteroplacental insufficiency. External factors like trauma, motor vehicle accidents, domestic violence, smoking, alcohol abuse, and the cocaine and the heroin. Clinical features like absence of the fetal movements, mother's first complaint, no fetal heart sounds on the auscultation, decreased uterine size, lag in the fundal height, absence of the weight gain or the even weight loss, fetal maceration signs if retained for greater than 2 weeks. Diagnosis: ultrasound, no fetal cardiac activity or the movement. Doppler ultrasound, absence of the umbilical artery blood flow. Fundal height measurement smaller than the gestational age. Laboratory tests like coagulation profile, risk of disseminated intravascular coagulation if retained for greater than 4 weeks. Clear wet kit test if Rh negative mother to detect the fetal maternal hemorrhage. Management: expected management. If no maternal complications, spontaneous labor may occur. Medical induction: misoprostol or the oxytocin for the labor induction. Avoid misoprostol in the previous C-section cases due to the risk of the uterine rupture. Surgical management: dilation and the evacuation for the early gestation. Rh immunoglobulin given if the mother is Rh negative. Emotional and the psychological support, counseling and the bereavement support are essential. Complications like maternal complication, disseminated intravascular coagulation, infection, endometriosis, sepsis, uterine atony. Psychological impact like depression, anxiety, PTSD. Prevention and the future pregnancy planning, identify and manage the maternal conditions, hypertension, diabetes and the infection. Lifestyle modification, avoid smoking, alcohol and drugs. Close fetal monitoring in the subsequent pregnancy. Consider thrombophilia screening in the recurrent cases. Defined as a fetal death after the 20 weeks of a gestation but before delivery. Most common maternal causes like the hypertension, diabetes, infection, autoimmune diseases. Most common fetal causes are the chromosomal abnormalities, congenital malformation, lager. Placental causes like abruption, previa, and cord accidents. Absence of the fetal movements is usually the first symptom. Ultrasound is the gold standard for the diagnosis. No fetal cardiac activity. Coagulation profile is essential to rule out the TLC in the prolonged retention. Induction of the labor with the misoprostol or the oxytocin is preferred in the late gestation. Rh negative mother requires the Rh immunoglobulin to prevent the alloimmunization. Psychological support is crucial to manage the maternal grief and the future pregnancy planning.